All right. Looks like we're ready to get started. Thank you all to join. If you just joined, I want to let you know I'm going to be going through some of the features of the Gateway to Global Aging Data and this set of studies that are conducted on retirement age populations internationally in conjunction with each other. If you have any questions throughout this webinar, you can raise your hand. There's a button for that, and I'll unmute you. I think everyone starts out just being muted, but I'll unmute you, and you can ask a question, or if you don't want to ask it verbally, you can just type it in the chat, or I pose a question, and I'll try to keep an eye on that window and answer those. So feel free to ask me any questions if you have any extra questions, or if something seems unclear. I am Driston Phillips. And I'm at the USC Dornslife program on global aging health and global aging health and policy, and we are a program inside of the Center for Economic and Social Research here at USC. So I just want to quickly overview all the studies that are kind of included in what we call health and retirement studies around the world. Most of these are funded, as are we, by the National Institute of Aging. And part of the requirements for that funding is that all of these data are freely available for research purposes. And there's some harmonization that goes on in how the studies are built and conducted. And then there is some harmonization that goes on afterwards, and that's really what we're going to be talking about today. But let's overview these studies. So the first study started in 1992. It's called the HRS. It's run out of the University of Michigan. And it's a nationally representative panel survey of Americans over the age of 50 and their spouses, and it's conducted every 2 years. So it's longitudinal. These are all multidisciplinary studies also, so they have a host of different research measures, which we're going to be looking at also. In 2001, the Mexican Health and Aging Study, which is referred to as MHAS, was added. And they had two waves of data in 2001 and 2003. And then they came back in 2012 for their third wave, and they're going to be having a fourth wave also shortly. In 2002, the English Longitudinal Study of Aging started. That's 50 and older in England, and that's every 2 waves. One large study that started was SHARE, which is the Survey of Health, Aging, and Retirement in Europe. And that includes almost 20 European countries and Israel, and that started in 2004. And they've added additional countries every single wave. That's a great resource if you want to compare different countries that are asked, the questions are asked in the exact same way. That's a great resource. In 2006, the Korean Longitudinal Study of Aging, it's called KLOSA, started. The IFLS, which is the Indonesian Family Life Survey, started. And it started in 93, but starting in 2007, the IFLS became comparable to the United States Health and Retirement Survey. So they started having similarly asked questions for a specific sample of retirement age individuals. Starting in 2007 also, the Japanese Study of Aging and Retirement, JSTAR, also started, and that's 50 and over. This is the one study that is not necessarily nationally representative. Instead, they selected, now they have 10 municipalities that they select from for their surveying. The study on global aging and adult health, conducted by the World Health Organization, also started in 2007. And that's a multi-country survey, so it includes China, Ghana, India, Mexico, the Russian Federation, and South Africa. So it's nice because you get a little more diversity as far as geographically included in that. The Irish Longitudinal Study of Aging, TILDA, started in 2010. The Costa Rican Longitudinal and Health Aging Study, which is referred to as CORELLIS, started in Costa Rica, so it's a Caribbean country. And that's persons age 60 or older, and they started in 2005, 2007, 2009 with their waves. and they added an additional cohort in 2010, and they've had another wave in 2012. The China Health and Retirement Study, which is referred to as CHARLES, again, it's a nationally representative survey of China, individuals aged 45 or older. So you can see there's a little variance in when these studies start following people. And the Charles sample is drawn from 150 counties in 28 of the Chinese provinces. And then lastly, the longitudinal aging study in India, LASSI, was started. They had a pilot in 2010, and their baseline wave is planned for this year. And the baseline sample is going to not only be nationally representative for the country as a whole, but it's going to include every Indian state. It's going to be nationally representative inside that state. So it's a great resource. And LASSI is also one of the studies that we're one of the organizing partners here at USC for that study. So overall, right now, these studies represent almost 50% of the world's population. So there's a lot of cross-country comparability, which is really kind of the powerful and interesting thing about these surveys is that they're longitudinal, and then you can compare between different countries, and they're multidisciplinary. So they're not just economic variables, they're not just health variables. There's a lot of different ones. And there are studies that are being added to this all the time. I think coming up right now, Brazil has their own study, which I think they're in the field right now for their baseline wave. Haggis, which would be a Scottish study, will also start, I think, in the next couple waves, as will Thistle, which is North Ireland. So they are all coming on, will be coming on this map shortly, and that data will be freely available, like for all of these studies, for research purposes. So I've mentioned how multidisciplinary these surveys are. So here's some of the core content areas. So all of these studies include survey questions about health, cognition, diseases, emotion, physical functioning, which would include activities of daily living and instrumental activities of daily living, different health behaviors, preventative health behaviors. They also include things like health insurance, healthcare, service utilization in some of the studies. So how often someone has been to the doctor, how often they've had any kind of different checkups, healthcare expenditure, and out-of-pocket spending on medical expenses and prescription drugs. There's also a host of employment variables, so labor force variables, employment status, history, earnings, whether they're on disability, whether they consider themselves retired, semi-retired, what were the characteristics of their last job that they had, or the job that they had the longest in their life, depending on the study, and then pensions also. And then economic status. So is really a vast set of economic questions. So these include health, consumption, earnings, government transfers, often family transfers also. So transfers from, particularly if you look at intergenerational questions, questions about whether your children gave you money or you have given your children money. Let's see, I have a question here. I know Share does, but do any of the other retrospective histories ask retrospective histories? So yes, so Share does have a retrospective model called Share Life. That was their third wave. ELSA also has a retrospective life survey, as does Charles. So those are three where there's a specific survey that goes through someone's entire life to be able to kind of capture a host of things, not just marriages, but it's often marriages, children, jobs. So those are all those are included. I would look if you wanted to compare something that used a retrospective life history. You could use Share, Elsa, or Charles. And the last of these that I'll mention are family structure, social network, family demographics, family exchanges, as I talked about, marriage, and social participation. And some of the key innovations of these studies are enhancing the quality of economic data. So there's a lot of item missingness that happens with economic data. So if you ask someone, you have a pension, it's pretty easy to say yes or no. But if someone says yes, and then you say, well, how much do you have total in your pensions? It's often a hard number for someone to give you. And so one of the things that these studies have done to kind of reduce some of that missingness is they included unfolding bracket questions, which say, okay, so if you don't know the exact amount, could you tell me, in the case of the U.S., is it more than 10,000? And if they say yes, then we say, okay, well, is it more than 20,000? And they say no, we say, okay, is it less than 15,000? So you can kind of narrow in on being able to impute, which means to assign a value for that missingness, so that you're still able to consider that person in your analysis. And then they've also integrated biomarkers into social surveys. So biomarkers include physical measures, blood measures, and anything as complete as a full genetic sequence. So some of the physical measures, kind of the standard battery, which are included in most of these, are height and weight. Sometimes these are self-reported. Sometimes these are taken. By a nurse. It depends on the survey. Waist or hip circumference, blood pressure, grip strength. Looks like we have one hand raised, which is Michael. Hey, Michael, I'll unmute you right now if you'd like to ask a question. Michael, do you have a question? All right, I'm going to keep on going, and feel free to just type your question as a question or chat if I have missed you. Grip strength, lung function, which is a kind of a puff test. It tests how strong the lungs are. Gait speed, so they'll have a time to walk, where they'll have someone walk from down a hallway or something a certain number of feet or meters, and that kind of helps to give you an idea of how far. They'll also sometimes do a chair raise, how long it takes someone to stand up for a chair, or a balance test. So some of the blood collections. So there are different types of blood collection by study, which has implications if you want to use these measures. So ELSA, Tilda, Charles, and MHAS have collected whole blood. HRS, Lassie, Germany, Share, and the IFLS have collected dried blood spots. And then some of the studies haven't started collecting blood yet. So those include Share, with the exception of Germany, CLOSA, and JSTAR. And then genetics, which is kind of this emerging field that people are very interested in, comparing genetics to, kind of all this phenotypical data about someone's life and the choices that they have made, to kind of parse out, what is happening that's genetic and biological, and perhaps what's happening that's environmental or behavioral. So the HRS includes a GWAS sample, and that's based on saliva swabs, and the ELSA includes GWAS data based on whole blood sample. And many other studies are also considering this. This is kind of one of those things that right now is kind of considered hot in research, and people are very interested in studying this. So one of the things that we've done is we've built a set of domain-specific user guides. And so these are kind of for one research domain, something like cognition. We would go through each of these studies and say, hey, here are how the cognition questions are asked in each of these, and here's how you can compare them. So the ones that we have currently are chronic medical conditions, financial transfers, expectations, employment and retirement, income, wealth, cognition, and health behavior. And that's a list that we are adding to. So those are great kind of resources to go if you just want to be able to download a paper and be able to read it to kind of get a general overview. And the other thing that we've done, which is more of a research tool, is that we've built the gateway to global aging data. And I will skip over to that. So I think you should be able to see the website right now. So this is a web tool that we have that we've been building here. We've been building for about this past 7 years. Let's see, Kara just asked a question. She says, is depression included in chronic medical conditions? Yes, depression is included in almost all of these studies. A couple of different measures they often use, if you're familiar, CESD, which is a measure of depression, or the Euro-D scale, which are both kind of batteries to get an idea of someone's depressive symptoms. And I think there are some general questions about, would you say that you are depressed? So those are both included. All right, I'm going to continue on here. So this is the gateway to global aging data, which is where we're going to be spending most of our time today to give you all a sense of how to use this research tool. You can see here in the top, this is kind of the things we're going to be walking through today. We have surveys at a glance, concordance across surveys, graphs and tables, download data and more, create analysis data sets, and publications based on surveys. So let me overview quickly what is included. So we've built a digital library of survey content, and we call that content, survey content is survey metadata, which I'll define for you shortly. We've built illustrative flowcharts which show a skip pattern. We've built that survey concordance, which is an intelligent search engine to help locate relevant search items across one survey in different waves or inside of one survey, but also between different surveys. So you can say, I'm interested in, in looking at depression in different surveys. How are those captured? We've built interactive graphs and charts to give you access to be able to play around with the data if you would like. We include integration with Stata to match survey items to dataset variables. If you're not familiar, Stata is a statistical analysis package that's often used in research, particularly by economists. We will also, I'll mention this later, we are also hoping in the next 2 years to add SPSS and SAS integration, but we do not have those built in yet. One of the things that we produce that I think users find the most helpful, or we produce harmonized data files. So these questions are asked in a similar, often asked in a similar way between these different surveys, but there's a lot of differences in any of these. And so one of the things that we do is we produce a data set for each of these surveys that includes kind of just those measures, which are most easily harmonized between the different surveys. And we make it really easy to find and compare those really similar survey measures. And then we also have a searchable library of publications based on health and retirement surveys. So when I say survey content or survey metadata, so survey metadata means the detailed information about all the parts of the survey without what we call survey microdata. So survey microdata would be someone's actual answers to a survey, right? So if someone said, yes, I smoke, no, I don't smoke. And so in the case of all these studies, we don't distribute the survey data ourselves. We'll tell you where to go to get it. But with the exception of Lassie, because we actually do distribute Lassie microdata, the Indian study, we kind of collect all the other parts of the survey to give you a quick way to look through these surveys. So these surveys are long and they're often complex. And sometimes it's hard to understand where a question occurred in the survey. What was a question, if you're interested in something like volunteerism. So like, was volunteerism included, in the SHARE questionnaire for the SHARE survey? Also survey questions including interviewer prompts, types choices, how the question was asked and to whom, links to microdata variables and how those variables are formatted. So the microdata variable is if you downloaded the data set, where is the data for a particular question stored? So we link those together for you. We also have assigned research topics, keywords, and domains to help you find them quicker. And we suggest similar survey items and also user notes. So let's look at some metadata. So the quickest way to jump back to that page here. If you are familiar with a survey, you can also often click at surveys at a glance. So you can see here all the survey metadata that is currently included. This is for the core interviews. We also have different tabs for health assessment, life history. So again, for life history, close ahead of job history, share life was in their wave 3. That question was asked before. 2006 also has a life history. And I believe Charles Wave 1 has a life history also. Self-completion, so these are often surveys that are mailed or left after that someone completes themselves. Exit interviews, which are interviews that follow up after, so if they come back to a home to re-interview in 2 years or for the next wave and someone has died, then they try to find the next of kin and they ask questions about what their death, the circumstances of their death. Community surveys, which I think is only included for Charles, so it asks questions about the community. And then we also have a study overview tab here, which is kind of it's a good place, that overview that I did with the map at the very beginning. This kind of overviews a lot of this. So like when, at what age is someone included in the survey, whether their spouse was included, how the survey was conducted, the method, so whether it's in person, self-completion, where someone fills out a survey on their own, or also telephone, the HRS uses a telephone. The number of waves currently collected, whether refreshment samples were added, so whether their sample has continued to kind of add new people every year as a way to balance it as a result of people dropping out. And then sample sizes and the type of blood-based biomarkers that were included. But let's look at the core interview. So this is where most of your survey content is going to be. So if we're interested, let's look at share. We can look at, so share wave 2 here. The other nice thing about this table is you'll notice that most of these studies, the different waves of these studies are referred to as wave 1, wave 2, but they're not consistent across studies. So, wave 7 of the HRS was in 2004, which is only wave 1 of share. So I think this table is nice because it gives you an idea of when different surveys came on and what would be the comparable waves if you were interested in looking at a particular year. So let's look at share wave 2, which was their 2006 wave. So the first thing you see here is a list of all the survey modules. So these include some cover screens, a demographics module, physical health, all the way through the end of the survey, which includes an exit interview, which people would probably skip to if upon coming to the household they find out that the person has passed away. So let's jump into one module. We'll jump into the behavioral risk module. Inside of this, you can see all the items that are included in these modules. So some of these are what we would call identifier or system generated variables. You can see that it has this icon here, which is ID. You can also see a couple of these are constructed variables here. And then you have these icon, which is questions. So these are really the questions here. And we'll just jump into this first question, which is labeled BR001. We know it's about ever smoked daily. So this is the question in share. So it's share. The question is ever smoked daily. We give you the exact question text. So the following questions are about smoking, drinking, alcoholic beverages. Have you ever smoked cigarettes, cigars, cigarillos, or a pipe daily for a period of at least 1 year? And then we let you know the answer choices are yes or no. We also let you know how those are recorded in the data. So a 1 is a yes, a 5 is a no. And then we have this associated variables. And that associated variables is going to be that's the name of the variable inside of the share microdata. So if you were interested in finding the data which corresponded to this question, that's where you would look. In share makes it quite simple, right? So the question BR001 is stored in a variable named BR001 underscore. This is not always so simple in other studies, which kind of don't use quite as simple matching for their questions and variable names. You can see it's assigned some topics. It's assigned smoking and tobacco. We'll let you know that the concurrent item, so this item in the 2004 wave was titled BR001 also. You could click directly into that. And you can also see, if you jump back, that researchers were also interested in, apparently someone was interested in this self-rated reading skills. So we do a bit of cart matching. So we say, it looks like people are regularly interested in these two items together. So it's kind of the idea is just to give you a leg up if there's some other items that you might be interested in because other people are, that you could look there. We also allow people to make comments. So for instance, if you knew something particular about share, you could say something about, in Austria, this question did not include pipe usage or something like that. And all of these questions, all of these comments are reviewed. But you can add those. We kind of wanted to give people the ability to have a kind of a Wikipedia-like system. So this is kind of an overview of what survey metadata is. Let's jump back to our surveys at a glance. And so we built, so, one way is we use the surveys at a glance. If you know the survey and you know kind of what the modules are and where the questions are in the module, you can browse through it that way. But for most people, these are long surveys and there's many of them. And so very few people would be able to say, oh yeah, here's where the smoking question is in Share, and here's where it is in Charles. So we built a survey concordance so that users can identify comparable survey measures between all health and retirement surveys. And you can do that a couple ways. You can use a keyword search. You can select a top-level research domain or a finer topic for those harmonized studies and for these harmonized data sets, which are where we've gone through and we've selected exactly what's harmonizable between different surveys. So this allows users to find and compare both measures between multiple waves of one study or the same year in multiple studies. So if we jump back to the website, let's look at this. So that's the concordance across surveys. And this is what it looks like here. So you can see this is our keyword search. If you just want to search by a keyword, you can select your studies. So you say, I'm interested in, just comparing England and Korea. So you can select those. You can select the years that you're interested in. And then you can select your topics. So these top-level research domain would be something like demographics. Or if you're using a harmonized study, you can select any of these smaller ones. So let's look at a couple examples. So let's say, for instance, we're interested in height. And then you could select, if you were interested in looking at China, you could select Charles. And then one of the things you'll notice, which is nice, is that once you select Charles, we let you know what years are available for Charles. So we could select Charles 2008, which would be their pilot wave, and you could select search. So you can see here we get a list based on the search of different height measures. It looks like these are all in the biomarker module, which makes sense. And then from here, you can directly jump into any of these. So we can look at this first one, and it looks like this is a question. In this question, they kind of asked, were you able to measure it? This kind of records whether they were able to measure it, and if not, why not? And then my guess is here for the second question, yeah, and this is true, this would record the actual height in centimeters, and they were allowed between 0 and the range that a interviewer was allowed to record was between 0 and 260 centimeters. And the associated variable is called this in the Charles data. Let's see, we have one more question from Kara. I hope I'm pronouncing your name right. What happens when you hit harmonized variable or flowchart? I will show you that shortly. We'll get to that. Let's look at a couple other examples of the survey concordance. So that was an example using, a keyword search. If you wanted to use some of these harmonized variables, so I'll show you that. So if you click harmonized ELSA and harmonized share, so you want to compare one exact measure between ELSA and share, you can see that these are the years which are shared between them. You would have 2008 here, but again, that was Share's life retrospective year, and so they didn't ask a core interview that year. So if we select 2006, and then you could select self-reported health status, and then we could go search. So you're going to see these harmonized measures which are there. So you've got harmonized ELSA, harmonized share, and you've got, we'll talk about this later, but this is R3, self-reported health. So that's exactly for the wave 3, and we have a respondent. This is a respondent level. This is a spouse level. This is a respondent level. This is a spouse level. And again, what you see here is this wave 3, corresponds to 2006 for ELSA, but wave 2 corresponds to 2002 for share. So we let you find things that way. Let's do one more search here. Let's type in health in general, and let's search share. That's the European and Israel study, and we'll do it for 2004. And if we search, so here's our search, we get these health in general questions. And so if we click into one of these, so Cara, I'm gonna get to explaining your question about what flowchart is. So you can click on the module here, or you can click on the item. Let's just click on the module in this case. So the physical health module, here's everything that's included in the physical health module. And we allow you basically 3 different views. So one of them is this list right here. Another one is called the codebook view, which kind of gives you one page where everything is listed out. So health in general question, how would you say your health is? And here are the answer choices. And if you're familiar with this, what you might notice is that you have these pipes right here at the beginning, and these let you know skip pattern. But there's another way to know skip pattern, which is these flowcharts that we've built. So a lot of these surveys have kind of complicated survey logic, which is to say that you don't want to continue asking. If someone says they don't smoke, you don't want to ask them. You don't want to spend the next 5 minutes of the interview asking them when they started smoking, and they say, "Oh, I didn't," or "What do you smoke most frequently? How at the time that you smoked the most in your life, how much did you smoke?" Right? You want to kind of skip out of these questions because it saves everyone time, and people do get survey fatigue going through these because these are sometimes long. So, for instance, here we have this question. So we start the physical health module here for share 2004. It looks like you get a random number which is generated, and it can either be a 1 or in this case it's a 5. If you get a 1, then you're asked this question, health in general, how would you say your health is? And you get this scale of very good, good, fair, bad, or very bad. If you don't get a 1 generated, you get this other question. So this is interesting. So health in general version 2. So they say, how would you say your health is? Excellent, very good, good, fair, or poor. And so what you notice is there's 2 different scales here. And one of the things that Share was doing is they wanted to be able to compare these 2 different scales. This first scale, version 1, is it's kind of a European or a World Health Organization scale, so it's very balanced. The second scale, version 2, is the US scale, which you would notice is weighted kind of more towards being happy, which might say something about how Americans see themselves. So Americans are given basically 3 kinds of ways to report that they are doing very well, whereas in this balanced scale, the version 1, they're given 1. They're given 2 options of reporting that they're doing very well, and then 2 options reporting that they're not doing well, and then 1 that is fair. So one of the things that Share wanted to test is how do these compare to each other. You can scroll through the entire survey, so you can see the skip pattern. I will say that we don't have this. These flowcharts are a little hard to build, and so we don't have these for all studies right now, for all surveys. We're constantly adding them. The other thing that you'll notice here at the end of this physical health module is it looks like you have these questions again. So you have this random number generator. So if you had a 2 instead of a 1 assigned at first, looks like you get asked the other question, right? So you do get asked both questions. And if you don't, then you get asked the other question, right? And this is interesting because Share also wanted to test kind of another phenomenon, which is how do people talk about their general health if you ask them before you ask them a battery of health questions versus after, right? So if you come to me and you say, Tristan, how are you doing today? I might say great. But if you come to me and you say, hey, when's the last time that you had your blood pressure checked? Would you say that your back hurts? All these questions. And then you say, okay, how would you say your health is? So that has a real kind of effect on how people answer. And so Share wanted to be able to test how important that was. So I like this example because it kind of shows you this flowchart really allows you to understand what was going on and why in this one module you had 4 different self-reports of health questions. So that's flowchart. Here's one more kind of simple example. This is a Share 2006 question of ever smoked daily, right? And if you have smoked, then the next question you're asked is whether you smoke now, right? We've also built interactive graphs and charts. So for all of this data, and we'll talk about this, you have to download it from the study that where the data originated. So we don't give you access to the data, but we did want to be able to allow you to use the data in a way or to gain some inferences about the population without having to download the data first. So we've built these graphs and tables. So we allow you to select from different countries. You can select a year. And then we currently have a limited number, but these are the survey measures we allow you to graph and to chart currently. And then we also allow you them to filter by age or by gender or to compare across different subpopulations, like to compare across different genders or age groups. Here's an example of one interactive graphs and chart. So this is the graph of whether currently working for pay, and this is comparing China, Japan, Slovenia, Sweden, England, and the USA in 2010. So again, this is using data for Charles for China, JSTAR for Japan, for Slovenia and Sweden it's from Share, England is from ELSA, and for the USA it's from HRS. We've done a lot of work in the background for these graphs and tables. So these are population estimates. So we've applied the correct weights. You can see here in the data notes the type of weight that was used. So in all of these, we used respondent level cross-sectional weights. We've also, in the case of complex survey design, we've accounted for that, which would affect the standard errors, which you would see in the table. We provide standard errors. And then we provide a link back to exactly that measure, which would give you more information about how that measure was constructed and how it might be different if there's a difference in how these questions occurred between these 4 or 5 different surveys that we have here. So let's look at a couple more just on the website right now. We'll generate these on the fly. So you can click on graphs and tables. And here's kind of the one that pops up, but let's look at a different one. So let's clear all this out really quickly here. So let's compare whether someone ever smokes. Someone reports ever smoking. So we need to select 1 or 2 countries or more. So let's compare Italy, the United States, Japan, and England. Let's compare those 4 countries, and we'll compare it in, let's say, just 2006. And so you can filter by age. Let's not filter by age. And so you notice what pops up here. Here we have our chart. So we can say ever smoke. So it looks like England. Interestingly, their population of people, in the case of England, right, it's 50 and older. On average reports 62% report smoking, and this is weighted again, which is a little less than the U.S. and significantly less than Italy and Japan. Which is interesting. I think one of the interesting things here to look at would be also to say whether to look at smokes now, so to see whether that changes. And so interestingly, smokes now does change, right? So actually, Italy and Japan have higher prevalences of people in this age group currently smoking, and looks like probably less than the United States and England, which are quite similar. And then you could ask a question like, okay, well, so it's something here, then we saw this real significant change in England, right, between ever smoked and smokes now. So is this a cohort effect? What kind of effect is this happening? So if you select just one country, and we'll leave it here on 2006, if you select one country, you can then compare across subpopulations. So we can compare for instance, by gender or by age. And let's do ever smokes, and let's compare it by age and the year of survey. And let's see what we get here. So it does look like there's maybe not a lot of difference. Let's see, we're getting 64, 62, and 65. So not a lot of difference for ever smokes by people. These are the age groups that we allow you to, that we automatically select for you. So 55 to 64. 65 to 74, 75 to 84. You could also compare across gender. You wanted to see if there was a gender difference. Looks like there is a gender difference that we didn't see in the age group. So ever smokes males is 70% and female is 55%. So you might have noticed these graphs have generated really quickly. How we do that is the first time a graph is ever generated by a user, then it's saved. And every additional time that another user generates the same graph, it pops up very quickly. If you don't, if I, for instance, selected, let's added like a tilde into here, and select 2010, and let's see, this might be, we select something maybe just for males, right? Go. So this is probably going to take like around 30 seconds for this graph to generate because it hasn't been generated before, but once it's been generated, if you're just patient, it will pop up. One of the other things that you might have noticed is that we don't allow you currently to be able to do cross tabulations. So we don't allow you to look at For instance, like several countries, both over male and female, and that's something we're going to be building in the next year. So for any of these graphs, you can print it, you can download a JPEG, a PNG file, a PDF file, or a vector image. And then we also have a table for each of these graphs. So you can see in this table includes the standard errors, and these standard errors in general are, where possible, they do account for the complex survey design. If there's some clustering or stratification that happens in the survey design. And these tables can be downloaded as CSVs or PDFs. So we really wanted to give you a chance to be able to play with the data before having it on your machine in kind of a way where we've taken out a lot of the legwork. A lot of the legwork is building the measure and then knowing which way to apply and how and what things are exactly comparable. So we wanted to give people an idea of how powerful these data are through our website. I'll show you a couple other examples. So for continuous value measures, something like total family income, we plot this histogram chart. And in this case, I've done it. This is for England in 2004, and it's over 3 different age groups. So 55 to 64 is the blue line. The red is 65 to 74, and the green is 75 to 84. And the interesting thing that you'll notice here is right the distribution changes. What this density looks like changes as people get older, which would make sense, right? As people enter into retirement, their income profile probably does change, right? They're getting less from wages and probably more from drawing on pensions. And here's one more example of a chart, and this is looking longitudinal. So this is United States between 2000 to 2010, and we looked at the net value of primary residence. And one of the interesting things that you can see in this table here is kind of the effect of the housing market crisis. So you notice if you look at the weighted mean or the median, that housing prices, to continue to raise from 2000 to 2006. They fall by 2008, and then they really fell by 2010. The other thing that you might notice is this 25 percentile becomes 0, and that's 0 because there's actually a decent sized subsample of people inside of the HRS, which have basically mortgages that are underwater, right? So the net value of their primary residence is they owe more on their house than it's worth. So you're getting a lot of negatives, which is really pulling that down. So I think the graphs and tables are interesting if you just kind of want to get an idea of the data or what's possible with these data before doing some of your own analysis. So to register, so everything that I've showed you so far, you don't have to register to be able to use it all with the Gateway to Global Aging data. You can play with the graphs and you can browse survey metadata before you register. So right now I'm registered. I'm logged in with Jane. We could log out here, and all these options are still available. What isn't available is this cart matching and a couple of other features, and that's what we're gonna talk about next. So I'm gonna log back in. Registering is very simple. Basically, you just have to tell us a little bit of information, what institution you're affiliated with, why you're registering. You make a password, and we'll send you an email just to confirm your email address. So I'm going to log in here with our Jane, who's kind of our example profile. So her profile looks a lot cleaner than mine does. And then with other things, so you're able to make cards, but you're also able to integrate with Stata. That's one of the things that is just available to registered users. And let me tell you what that means. What does it mean for a website to integrate with Stata? So for instance, if you have some survey microdata, so you have the health and retirement survey, you've gone to the University of Michigan, you've downloaded their data onto your computer and you've stored it. You can then use the Gateway to Global Aging data to say, okay, I'm interested in looking at this U.S. population using the HRS survey. I'm interested, in smoking, in volunteerism, in CST depression, gender, education. Let me kind of select all the questions I'm interested in. This gives you an easy way to select these. And what we do using Stata, we're going to create a Stata program for you, which is going to generate a data set for you. We're going to give you a Stata program, which is referred to as a do file, which will go through all of the all of the HRS microdata and pull out those data which are just related to those questions you're interested in looking at. And this is helpful because often this microdata is distributed. So like one wave of the HRS is distributed in 20 different files, right? For each module is its own file. So you might be interested in a question about volunteerism, but you don't know where that was asked or where CESD depression measures were asked. So this allows you to, we've kind of taken a lot of the legwork out, a lot of the headache and the repetitiveness of going through these surveys and saying, okay, I'm interested in using these 17 questions in my analysis. They're going to come from these five different data sets of the HRS 2004. Let me pull them out and merge them together. So let me, so how this works is through the data options page. So if you're logged in, you get this option here called data options. So what we do is we store, is you would tell us where the different microdata that you have is stored on your computer. So you can see I've said that I have the ELSA 2002 microdata, and it's stored in a folder called C drive ELSA data 2002. And I've got the HRS 2006 data, and it's stored in 2006 data and shared 2004. And we also have this prepend.do file. So if you're familiar with Stata, .do is the extension that is used at the end of a Stata file. And we just put these at the beginning of everyone's program. You can change these to customize these just for yourself to kind of help Stata run more quickly. So what happens when you when you generate a file is because you've told us where that file is located, then that Stata program we're going to give you is going to include the location of the data. So you don't have to go in and change the folder location every time that you run one of these programs. So we just wanted to cut out some of the headache for you. So let's just go through an example of like how this might be helpful. So you can create a collection of survey items which are specific to your research using your item card. We call these analysis data sets. So you can do that by searching for relevant survey items, browsing by survey for relevant survey items, using that concordance, browsing by topics, also using the concordance for harmonized survey items, or using predefined cards. So I would click on this analysis data tab here on our website kind of as a place to get started. So, and again, here we've got these kind of options for you here to how to make your analysis data if you're interested in it. And it's really pretty simple. And we also have these predefined cards. So these are cards that we've kind of made for you, which have a bunch of basic variables that you might just want to include, right? These are kind of, these are all the things about basic demographics like education, gender, age, year at birth, that people often include in these regressions because they've, in analysis, so often proven that these things, should be controlled for. And we also include sample weights, indications if someone's still alive in that wave and if they participated in that survey. So these are often nice to just throw in. So let's go through an example. So let's say we want to compare whether health limits any paid work in 2006 between the US and England. So to do this, we could select variables from the HRS and ELSA. We can make sure we have those file locations for all those variables. We can create a cart. We can download and run a do file, and the result is going to be one data set with information from 2 studies without other extraneous variables. So let's do that. So if we go, let's use our survey concordance here, and let's say health limits paid work. We'll select that, and again, we're interested in the HRS and England, right? So the United States and England. So we'll select HRS and ELSA. And we're interested in 2006. So let's just search that. So here are the questions we get. You can see we've got a mix of ELSA questions and HRS questions. I know that this question is referred to as HELWK and ELSA. You can just click into that if you wanted more information. So this question is, do you have any health problems or disabilities that limit? This is exactly the question that I want, right? Do you have something that's limiting, a health that's limiting how much you can work? So you could add this to your cart. You can do this just by clicking on this little cart icon right there. It's added. You can see automatically you've got one item in your cart. And then you could also, if you wanted to select several of these, so whether health affects paid work is KM002 in the HRS. I know that, but that was in the disability interview. It's also in the disability for re-interviews, so we could select both of those, and we could select those and also click add to cart there. So now you can see we've got 3 items in our cart. That's great. If we go, let's go view cart. So let's look at these. So we've got the item label, which survey they're from, a general description. You can also see we have this status icon here, and we got to check for these HRS questions, and it says you've indicated the location of this data set. Kara, just saw you asked another question. Yes, the service is absolutely free. It's funded by the National Institute of Aging under a grant, and yeah, it's free, and yeah, we really hope that anyone will be able to use it. Yeah, we just ask that you register, and when you register, if you use this research, we would just ask that you cite us in your research, which is part of your user agreement. So yeah, so there's no pitch at the end of this for the low price. The low price is free. So what you notice here is that we don't have this check mark besides our ELSA data, which says we've not indicated the location of this data set. So let's go to our data options page, and let's see, I have the ELSA 2006 data, so we can click on it. We can say ELSA 2006, and I know that this data is in ELSA_data 2006 folder. So that's where it's located on this computer that I'm using now, and then we can add dataset location. It pops up, and then if we go back to our cart, let's see. All right, we've got check boxes for everything. That means I have the location of that data. So one of the things we allow you to do is save a cart. So if you wanted to come back to it later, so for instance, I could just click here, save cart, and I could give it this name, health limits work, US England, right? So if I wanted to come back to it, I can save that. You can see it pops up here in my saved carts. I have some other saved carts here, which might be useful. So I've got one called Basic Demographics for ELSA 2006 that I've made before. And so I could append that to this current cart. So it's going to add in year of birth and gender, right? 2 just basic variables that I might want to look at. If there's an effect of health limits paid work, if there's something that's being stratified over gender or age. And then let's also add in for the HRS append to cart. So let's make this as a do file, right? So this is what I'm interested in. I could select all of these here and click create.do file. So when that happens, we create a do file that's specific to you. You can run it automatically in Stata, and as long as you have those file locations right, it will give you the data set automatically, and you could save that, assuming you have the data. In this case, I'm just going to open it, and I'm just going to show you what it looks like. And it's pretty simple here. So in this case, we read in that prepend, those first things just to help Stata run well. We say we're going to use this ELSA data. So we know, so remember this folder location, they know that it's stored here on my computer. We also know that that this file name is called ELSA wave 3_core data phase 2 version 2, right? This is where this is located. And then these are the variables that we keep. You can also see these are the variables we listed. This is the gender, year of birth, health limits work, and we've also included these 3 unique identifiers. So we never drop unique identifiers for anything that we create for you. And this includes the harmonized data sets or your analysis data sets, because we always want you to be able to go back. We don't ever want to break linkage with the original data. So you can always go back and merge in something else later. We append with one of the HRS data sets. So we keep this KM002. Then we append with another one of the HRS data sets. Again, and this is where we are getting a KM00 or KM002 without the Z. And then we're going to append one more time, and I think this is where we get our gender variable for the HRS. So you can see we just kind of cut a lot of the legwork there for you out of knowing which file to look in, specifying where your file is, and then what you should get at the end of this is an analysis data set. So this is an example of if you opened up this data set in this data browser, what this would look like. So you can see here we've got, this is kind of the breakpoint right between the HRS and ELSA. These are our HRS variables. These are our ELSA variables. And here on the bottom right. You can see we've got our KM002, and this is stored as 5s or 1s, which are yeses and nos in the HRS. And then our question here, HELWK for ELSA in the bottom right. And it looks like ELSA has value labels applied. So we're seeing no, don't know. And so this is kind of a great, this is a star, right? We've got everything together in one place. But we also wanted to kind of create, there are some differences here, which you will notice. And one is that we've got these different variable names, right? So the information that we want to compare is in KM002 and HELWK. But it looks like those have different, one has value labels applied, one has a 1 and 5 for their yeses and nos, which are some differences, and they have different variable names. So there's still a little more legwork, and that's kind of where we built these harmonized data sets to come in. I also want to, I kind of skipped this over, I want to mention the download data and more tab. So, I told you that I had this ELSA 2006 data already, but let's say that you didn't. So let's say you're interested in using ELSA data, but you don't know where to go to get it. So we've got this table here, which includes links to download all of the survey data. So for the HRS, you would go to Michigan. For MHAS, you would go to the University of Texas Medical Branch. ELSA is from UK Data Service. All of these data are freely available for research. You have to usually go to them. You have to sign up. You have to tell them what you're doing with it. You have to say that you're not going to do anything evil or commercial with it, right? That this is for the purpose of research. And it might take a few days, but you can get access to it and then download it for yourself. So this is where I think this is a great starting point if you want to download and register for these different data sets. This is also where you can download harmonized data sets if they're provided, or we give you the Stata program to create that harmonized data set and the codebook. You can also see here at the bottom, we've got a couple other things. We've got links to some other sister studies. We've got those working papers that I mentioned at the very beginning about chronic conditions, financial transfers, expectations, which would compare a whole research domain. Helpful brochures if there's anything interesting to you. And then we've got some recent presentations also. And I'll let you know, we did a webinar last year, and we recorded it and put it online, so it'll be available. And this one will also be available. So if there's something that you feel like you're missing now, you can certainly come back. Looks like we have one more question. What's the difference between HRS and harmonized HRS, or share and harmonized share? That is a great question, and that is exactly what we're talking about next. So harmonized data files. So harmonized data files are created to provide harmonized measures of international aging and retirement studies. So we create these data sets which are going to have just the most comparable survey measures between different surveys. So these do not, so there are lots of parts of share which aren't going to be directly harmonizable with a part of the HRS or a part of JSTAR. So it's not everything that's included in the share, for instance, is in the harmonized share. The harmonized share is a subset of the share data, which can be harmonized with these other surveys. So harmonized data sets are always defined as similarly as possible to the RAND HRS definition of a variable. When I'm saying RAND HRS here, so almost from the beginning of the HRS, the RAND Corporation started to produce this very user-friendly version of the HRS data. And that's the primary way that people use HRS data because it's just very user-friendly, and it has some of these things. And we've basically taken that as, we've taken our cues from the RAND HRS about what users like an easy-to-use data set. So we use a lot of these hallmarks, which are the data sets are structured in FAT format. So where every individual is in one record. So it means that we have, so for the RAND HRS or for the harmonized share, that's one data set you download. There's not a different data set for each module or for each wave. So there's one person is one record, and their information is listed out. So as you saw before, our variable names are something like R1, and that's where the information for wave 1 is stored. Then you'll have R2, information for wave 2. And so these variable names, for instance, R1 work, we try to make them really simple and easy to understand. So R1 work is whether the respondent, that's the R, is currently working, that's work, in wave 1, that's the 1. We also kind of indicate how similar variable names are. So if a question is not exactly the same between different studies, then we will not give it the same variable name. We really, we don't want to have people think that something is very comparable when it's not. So for instance, a variable like if it was R1 work, it would be _M if it was asked in the MHOS. And the question was it was asked, this measure of whether currently working is asked in the MHOS, but if it was asked in such a way that it was kind of significantly different from how it was asked in the HRS, we use the HRS as our basis, then we would give it kind of a survey-specific name, so _M. And then we also include spouse versions of most of these variables, so that you don't have to, if you're interested in looking at a spousal effect, you don't have to do that spouse matching yourself. So the spouse variable name would be called S2 work, which is whether the respondent spouse is currently working in wave 2. Here are the current harmonized data files that we have. We are adding to these all the time. So for harmonized ELSA, we have the first 5 waves of ELSA. Harmonized share incorporates the first, second, and fourth wave. So they have that life retrospective module, which we do in fact use, but it's not its own wave. And share just released their wave 5 data, so we're going to be adding that in the next couple of months. Harmonized JSTAR incorporates the first 3 waves of JSTAR. Harmonized CLOSA is all 4 waves of CLOSA currently. Harmonized LASSI currently includes the pilot data of LASSI. As soon as that baseline data is made available, we'll have the harmonized LASSI also available. And the harmonized Charles incorporates the first wave of Charles currently. We're adding wave 2 also. And then the 3 others that we're building right now are harmonized MHOS for Mexico, harmonized Corellis for Costa Rica, and harmonized Tilde. And kind of the place to look for all of these here is this download page. So you can download for all of these. We provide this data code. So if you have the original data on your computer, you can just run one Stata program, which will give you the harmonized data set, and you can save it on your computer and use it whenever you want. And you can also see that for MHOS, which I mentioned, and Tilde, we do have beta versions currently available, which don't include, they're not totally finished, but we do have what is currently available already online for you to look at. So these harmonized data files are either distributed through our website or by the originating study, right? So if you want to use the harmonized ELSA, it's actually part of the ELSA download that you download from ELSA. In some cases, for share, for instance, share doesn't provide you the harmonized share, but we will give you this data program that you can download and run. So let's look at an example of what harmonization is. So simple harmonization. Let's say, for instance, we want to create a measure of whether whether the respondent is smoking now, right? So we're going to give it this variable name. We're going to look at share 2004. So the variable name is R1. Wave 1 was 2004 of share, smoke in, right? So whether the respondent smokes now. And we're going to use the same coding for all of our variables. So 0 is always a no, and a 1 is always a yes. That's across all harmonized data sets. And this is what on the left here is what the share survey logic looks like, right? So there's a bit of a skip pattern here. So first you get asked if you ever smoke daily, yes or no. If you say that you have smoked, they ask if you smoke at the present time. So in a really simple example of harmonization, is that if you say no, we're going to give you a no for smokes now to smoke daily, right? We know that if you've never smoked, you're not smoking now. And we give you, also if you say that you used to smoke, but now you've stopped smoking, we'll also give you a no. And if you still smoke, we'll give you a yes. So we've accounted for that skip logic. We've taken these 2 things, we made it into one, and we've given them, a clear name, which lets you know that it's consistent with other studies, and given it the same value labels as would be used, the value codes that would be used in all studies. So that's a really simple example. I'll show you just really quickly a really complex example. So we also have these financial measures, which are really hard to make. So for instance, if we're trying to make one part of a household assets portfolio, which is savings or checkings value, we're going to make that for the harmonized JSTAR. So JSTAR used kind of 2 different surveys. They used the self-completion first, and then they used a CAPI survey. And if you didn't give enough information in your self-completion, you were asked a CAPI. So we start to capture all of this, and they ask you questions about, and this includes you and your spouse together. The respondent reports for the spouse in JSTAR. So we go through all of these items. In the case that someone says that they don't have the amount, that we include a 0 for the respondent, we would add the spouse value. If the spouse doesn't either, we would assign a 0 for it. These are all, if you didn't answer in the self-completion, you go to the CAPI. How much do you have? If you don't have the asset at all, you say you have no checkings or savings, we would assign a 0 value. And then you can see that JSTAR also used these self-completion or these unfolding brackets, right? So they said, do you have, if someone said, I have a checking or a savings account, I don't know how much is in it, then you get these unfolding bracket questions. So they ask, do you have more or less than blank number of yen, right? And it's not blank in most surveys, but in JSTAR, they actually allowed the interviewer to make up these numbers themselves. So, and I think the idea was the interviewer would go in, they would see their house, their living conditions, and they could actually, intuit better bracket values than we might do if you just set them programmatically the same for everyone. So the interviewer would say, hey, so do you have more than 10,000 yen in savings? If the person says yes, then they would say, do you have more than 100,000 yen in savings? If the person says no, they would say, okay, well, so is it less than 50,000? And if they say yes, then what you know is that we don't know their exact value, but we know that it's between 10,000 and 50,000, which has really narrowed down that scope, which can be important. And so we also provide imputations where it's not available by the study. So for instance, in the case of that person who has between 10 and 50,000, so we impute that value. So we assign a value for it if you're interested in using that value. Of course, we flag it if we're going to assign it. And we assign them a value which is going to kind of do the least amount of bias to your results, but allow you to still include that person in your analysis. And so for each of these, so you can see there's a lot of work that goes into, right? Like, so this is just for checkings and savings. There's a lot of work. There's a lot of understanding that you have to have about the JSTAR survey. And this is, this is maybe a month, a month of work for a programmer. And then, to make an entire, wealth portfolio, which is maybe what you want. Like maybe you're not an economist. Maybe you're interested in looking at something totally different, something like depression or grip strength and longevity or something. But you think that there might be something related to someone's income or wealth, right? And so you just want to control for these things. So we've kind of, a total wealth portfolio from JSTAR. This took 2 programmers half a year to be able to build. So we've kind of given you all of this information and all this programming that you can use on your own without having all that economic knowledge. And so for all of these, we include harmonized codebooks. And each harmonized data set is accompanied by its own codebook. It includes a brief overview of statistics for each variable. We detail any variable creation and any assumptions made in the creation. We highlight any differences between this harmonized variable and other harmonized variables. And then we list all the variables from the originating data set used in the creation of other variables. Looks like we have one more question. What about currency conversions? Is that all standardized to American dollars in the given year? So no. If you use the graphs and tables, that is all standardized to be in 2010 US dollars. But inside of these harmonized data sets, it's not standardized because we don't know necessarily your basis for comparison. What we do include, though, is inflation factors. So if you wanted to put them all, say in 2000, that's usually 2010 is what we use for our analysis. So we'll give you the inflation factors to be able to compare things in between one study. And then it would be on your own to be able to compare between 2 studies. You'd have to look up whether you want to account for purchasing power parity or not between those different years. So let's look at an example. It's a good question, though, of these harmonized codebooks. So this is our simple example. This is ever having smoke. So you can see we've got, this is for shares. So we've got wave 1, wave 2, wave 4. We've got two measures we make here, which is smoke ever and smoke now. And for both of these, we have respondent level and spouse level. We've got descriptive statistics, and these are not population estimates because these don't have weights, but we want to give you an idea of what the distribution looks like inside of the data. So you can see we've got these mins 0 and 1 because these are both binary indicators, right? We use a 0 for no and a 1 for yes always. And you can see these means here, so you get an idea of what the data look like. Because this is a categorical variable, we list all the categorical variable codes. So you can see we have always a 0 for 1, and these are the frequencies here listed out. You can also see that we use these special missing values, which they have in SAS and Stata. So a .d is it's a flag for don't know, and .r is a flag for refuse. So we want to give you like a little more information, right? We let you know that this data is missing, but here is why we know it's missing. It's because the respondent refused to answer, or they didn't know the answer. And there's a host of special missing codes. Here's our how constructed text. So it indicates, so we say, RW smoke ever indicates whether the respondent reports ever having smoked daily for a period of at least 1 year. And the answer to the respondent's first ever smoked daily question is carried forward in subsequent waves. So inside of share, the first wave that you were included in that you answered, if you said yes to it, then they're not going to ask you whether you've ever smoked in the next wave. So we kind of feed forward that information inside of our programs. And then we tell you things about the special missing codes, what they mean. We highlight any cross-wave differences. So if that question changed in between different waves of share, that could be important, right? If it changed in between the first and the fourth wave, depending on your question, that could be important. And then we highlight any differences with the HRS version of the question. So for instance, we say here, in the share survey, respondents are asked whether they have ever smoked daily for a period of at least 1 year. In the HRS, respondents are asked whether they have ever smoked daily, regardless of whether they've ever smoked, regardless of whether the smoking was daily, and not given a definitive period. Right. So these surveys between the HRS and the share are capturing something, depending on what you're looking at, maybe very different. So we really highlight any of those differences here for you. And throughout all of this, we try to be as transparent as possible. So we've made some assumptions in making these, and we want to communicate very transparently any of those assumptions to you. And if you disagreed with some of our assumptions, that's why we include all of the raw variables used, right? So these are the names of the variables that were used to create these variables inside of the harmonized share. So if you wanted to code these differently, you could look here. That's kind of a good starting place to say, okay, I'm gonna change exactly how they create this comparable measure between the HRS data and the share data, but I know where to start. And let's look at we'll briefly just run through. Here's the code book for kind of our complicated example. So this is our value of savings or checking, part of the asset portfolio for the harmonized JSTAR. You can see our mins and our maxes and our descriptives. And then you can also see we have this flag here. And this flag is going to let you know about the imputations because I think you want to know what's going on. So, these flags always between all data sets have the exact same code. So 1 always means it was a continuous reported value. So the respondent said, hey, I have a savings account. This is how much yen I have in it. We also have a flag of 6, which is no asset, which means the respondent was assigned a 0. They said, I don't have a savings account. So we know that we assume they have 0% or 0 yen in their savings account. So they're assigned a 0. And then we also have this complete bracket, which is to say that they were assigned a value in our data set, and that was based on knowing that it was more than 10,000 yen and less than 40,000 yen. Or an incomplete bracket, which is to say that the interviewer went into the bracket questions and all we knew was that it was more than 40,000 yen. That's as far as the interviewer was able to go. So we know some information, right? But we don't have, it's not, the range is only one-sided. You can also say, there are some cases where, you get to a bracket question, the person says, no, I don't know to all of the bracket questions, and you don't know anything there. And then the people who say they don't know, the 7 don't know, is that they don't know whether they have a checkings or savings account. And then JSTAR also includes top-coded values. So we also flag any of these top-coded values because those are important to control for in your analysis. Here's our how constructed text. Again, because it's more complicated, this is a lot longer. We talk about everything that went into about how this question was asked in JSTAR to how we constructed this harmonized measure. And then we list all of the variables that were used to create these. So really quickly, just wrapping up, I want to kind of go back to our example analysis, but let's do it with harmonized data, right? Because I think that we can control for some of those or we can kind of go one step further than some of those problems we had with our analysis data set. So let's say we want to compare whether health limits any paid worked again in the US and England between 2006. But let's do that with our harmonized measures. So we're going to select variables from the RAND-HRS and Harmonized ELSA in this case. They're going to have similar variable names conventions. We're going to download and run our generated do file. And the result is going to be one data set with easily comparable and similarly named measures from the two studies. So let's jump back. I've got some items in my cart right now. I'm just going to select all, and I'm going to remove these from the cart, which is okay, right? Because I already have this saved cart right here. So if I wanted to ever come back to that for a different analysis, I can certainly come back to that then. And then let's go to our survey concordance, and let's search. So let's say health limits work. And we're going to select this from the RAND-HRS and from the Harmonized ELSA. And we're interested in 2006. And then in this case, we can actually here select any of these. So we can select self-reported health limits work is what we're looking at, right? So health limitations. Or no, so we could select that. We could also just select search. So let's do health limits work, and let's say search health limits work. So you can see here are the harmonized ELSA and harmonized JSTAR, or harmonized and the RAND-HRS variables. So let's add these to our cart. So we're going to add R8 health limits work from the RAND-HRS. And from the harmonized ELSA, we're going to add R3 health limits work because 2006 was wave 3 of ELSA and wave 8 of the HRS. But what you can see is that these have the same variable naming conventions. If you jumped into any of these, you would automatically see that our answer choices, again, is going to be a 0 for a no and a 1 for a yes. These are exactly the same. And then we can jump into our cart here. We can select all. We can create our do file. You know, it looks like I haven't listed where the RAND-HRS is on my computer. I could do that and create a do file. And then when I run that in Stata, here's what the result is going to look like. So again, here we have the breakpoint between the US and the English data. We list which survey it came from. Again, we always include unique identifiers. So we have HHIDPN, which is the unique identifier in the RAND-HRS data, and IDA unique, which is the unique identifier for the ELSA data. And in this case, I've given this variable a wave-specific name. So now I'm going to call R06 for 2006 health limits work. And what you can see is we've got this coding exactly the same. So it's always ones or nos. And so it would then be quite easy to go through and to make this data set. If you thought, hey, so health limits work, you know, maybe this, you know, probably something could be happening here between different ages or different genders, then you could add in one of your base cards if you wanted to include some more, if you wanted to include weighting. So we could add in here our RAND-HRS base card. So we could say append. It's going to add in a bunch of so total wealth, total income, whether the respondent was part of the wave, and then some weight variables, some marital status variables. Got quite a few in there. Then you could also add in your harmonized ELSA base card, so we could append that also. And then if you wanted to create all these together, you know, still, again, the only thing you have to do to make this data set is select all and create .do file, and then you've got that Stata data set with even more information than you have right here. So the last thing I'm going to talk about as we wrap up here is our literature search. So we wanted to give people a place to, you know, a central place to look for literature, which are based on all of these data sets around the world. And maybe it's specific to a certain research topic or a certain year. You can also search by title, author, or source. All results are linked to Google Scholar. And we also include export, you can export citation information. So if you jump into the website, that's under this publication based on surveys tab. So you can see this populates right here. You can, for instance, you could select for a certain survey. So say if you were just interested in looking at research using the MHAS, you could select this and you're going to get a list of research using the MHAS. You can see you get 230 entries here using that MHAS data. For any of these, You can click in it you can get a direct link to that paper if it's available, or also a link to Google Scholar. We provide some more information there. If you want to click off of that, you can also select by topic. So let's just say you were interested in health in particular. So you could select health, and we've gone through all of these papers and flagged them for what their topics are. So these are all papers related to health, sometimes health and something else, right? Health and demographics in this case, health and income in this case. So it's a good starting place. You could also search by author. So for instance, let's say I'm interested in looking at Eileen Crimmins, who is here at USC also. I could just search by Crimmins, and I could see the different papers that she's worked, that Eileen has worked on here. And you can select any of these here, and then if you scroll down, you can export it as a text file, a CSV file, or an EndNote file to give you those citations kind of in one central place. You can see we've got 5,000 total entries, so a lot of research has come out of these surveys so far, and every year we go through and we kind of scan and crawl, and we see what else has been published in the last year that we can add into this repository. You could also search by source, for instance, if you were interested in looking in the, this is the AEA, or probably in this case, it's going to be the American Economic Association. You could search by a specific source that you're interested in. You can search by that, or by year, saying I'm interested in research only published between 2010 and 2020 or something. Something like that in the future, just recent research. You can search by that also. Yeah, so I think that wraps this up. Let me just briefly, I'll show you our help tab here. So if there's something that I've gone over today which isn't clear, we've got some basic instructions here about how to use the Gateway to Global Aging Data. For instance, like, where do I download the data? These are frequently asked questions. Yeah, what studies do we include and why? What is harmonized data? How do I use it? And then we've got some basic instructions for something like searching for a relevant survey item, browsing, saving a cart item, saving a cart, listing the file locations, or creating an analysis data set. And we also have a help desk that we maintain. So if you ever have any questions truly about something is not working on the website, or you have a question about the website, or even a suggestion about the website, we're constantly trying to improve this tool and make it more user-friendly. So please email us anytime. We will get back to you within 24 hours. Or if you have a question about research, you say, hey, I'm interested in comparing cognition and longevity between different education groups in these countries. Can you help me get started with knowing what's available, what surveys I might look at? You can absolutely email us, and we should get you back. We have a team. We work as a team here, and so we have a lot of people. You can see about us. So we have a lot of different people who work with us. About 10 different people, a mix of economists and different researchers and programmers. Yeah, so thank you guys very much for coming to this webinar. I'll stick around here, so if anyone has any questions, you can raise your hand and I'll unmute you and you can ask a question, or you can type it in the questions, as some people have been doing. But yeah, thank you for joining us. I encourage you to, if you haven't, register to use the Gateway to Global Aging Data, and let us know if you have any questions. Thanks. All right, looks like Victor, you have a question. I'll unmute you if you have that question now. Victor, are you there?
Thanks.
Oh yeah, absolutely. I'm seeing lots of people say thank you in the answers here. I appreciate it. I thank you all for making the time. Please encourage your, we spend a lot of time developing this, so encourage your colleagues also to, to use this research tool. If you have any workshops that you guys do at your school or university or research institute that you'd like us to send brochures to, or anything like that, or have us come speak, I can give this demo also in person, so just let us know. All right, I think that about wraps it up. Thank you guys for joining.